Welcome to the Unscripted Woman Podcast, the show for women who are done living by the rules and ready to reinvent their lives from the inside out. If you're ready to design your next chapter on your own damn terms, you're in the right place. Let's get into it. Welcome to the Unscripted Woman Podcast. Today I'm being joined by Dr. Cameo Green Coleman, and just reading her CV is going to take me half of the show. So, Dr. Coleman is a native of Columbia, South Carolina. She began her collegiate studies at age 17 at the University of South Carolina before earning her Bachelor of Science in Nursing from USC Upstate in 2007. She went on to complete 2 Master of Science in Nursing degrees and a Doctor of Nursing Practice at the Medical University of South Carolina, where she was recognized as a first honor graduate, Valedictorian, Presidential Scholar, and Fellow. Her doctoral work focused on strengthening heart failure care for rural communities. Dr. Coleman is a nationally certified as a family nurse practitioner and brings over 11 years of experience as a doctoral prepared FNP, along with more than 5 years of clinical practice in both inpatient and outpatient psychiatry. She recently earned her postgraduate psychiatric mental health nurse practitioner certificate from Purdue Global University, where she was inducted as a presidential member of the National Society of Leadership and Success. She is certified as a psychiatric mental health nurse practitioner. Dr. Coleman is the founder and owner of Whole Path 360 Family and Mental Care, LLC, which is a practice where she provides telehealth services to patients in multiple states, focusing on whole person mental and family health care. She's also a certified human rights consultant through the U.S. Institute of Diplomacy and Human Rights in Washington, D.C., and serves as an ambassador for Sick Cells, advocating for individuals and families impacted by sickle cell disease. In addition, Dr. Coleman serves as an appointed official for the Lancaster County, South Carolina government, where she represents District 7 on Health and Wellness Commission. Her continued professional development includes advanced training in psychopharmacology, neuroscience, addiction treatment, trauma-informed care, telehealth, nutrition coaching, neuro-linguistic programming, and integrative wellness approaches. She has completed the Master Psychopharmacology program through the Neuroscience Education Institute, U.S. Health Law Fundamentals through the University of Pennsylvania, Addiction Treatment Clinical Skills for Healthcare Providers through Yale University, Applied Nutrition Coaching through the Nutritional Coaching Institute, Brain Story Certification through the Palix Foundation and Alberta Family Wellness Initiative, Certified Trauma-Informed Coach Training through the International Compliance Assurance for Holistic Practitioners, and Board Certified Telehealth Professional Level 1 through telehealth.org. She has also received specialized training in treating autistic adults through Harvard University and recently completed certification programs as a breathwork practitioner and a live artificial intelligence practitioner. Dr. Coleman was named one of the top 100 women to know in North America, an honor sponsored by Visa and Know Women. She's also a member of the Forensic Scholars Membership Program at the American Institute for the Advancement of Forensic Sciences, Forensic Studies. A respected speaker and community advocate, Dr. Coleman has presented at schools, universities, and civic events, including the Dr. Martin Luther King Jr. celebration in Hopkins, South Carolina. She was recognized as the top healthcare provider in 2020 by Columbia, Greenville, and Charleston business magazines, and named a Midlands Woman on the Move. Her biography is archived in the Richland County Library's Black History Collection. Dr. Coleman currently teaches at Claflin University and is an active member of Sigma Gamma Rho Sorority, Incorporated, and the American Association of Nurse Practitioners. My goodness. So after all of that, I do actually have a couple questions.
Yeah, sure.
Um, Live artificial intelligence practitioner. What
The
is that? I've never heard of that before.
It's just AI, really. It's just really the course. It was over an 8 week period. It was through Wild Success, which is out of Australia. I love collaborating with other countries. But basically during that time, we just really learned not just about like Chat GPT, but just where we're at as a nation as far as AI. I think they called it live because the training was live.
Okay.
So, but it really was just a crash course on different AI tools and really how AI has been around for like now it's a big deal and it's a subject, but really it's been around for 20 years, some form of
Mm-hmm.
AI.
Mm-hmm.
So really, it was just learning about the history of it and then how to navigate it, and then how can we possibly be leaders in AI in our respective fields because everybody wasn't healthcare providers on the call. Some people, were bankers or
Mm-hmm.
but it just kind of helped us to realize that they have like AI agents and leaders. And so that program allowed me to see how maybe I could lead in the AI circle, but as a healthcare provider.
Oh, very interesting. So they're looking at incorporating AI into medical care.
Oh yes, that has been the big topic of some hospitals already have some form of AI caring for patients. A lot of times with physicians, surgery, and everything like that, they are using AI to let them know like where the incision should be at. They are using AI to scan for like masses. Um, so AI is still it's being used everywhere, and the goal is to try because we have such a shortage. We have a shortage of physicians. They always talk about we have a shortage of nurses, but some people argue that we really don't have a shortage of nurses. It's just that the pay and the stress is what's taking nurses from the bedside. So that's debatable whether we really do have that shortage. But they want to use AI to replace, critical thinking among healthcare providers. But what I would caution is that even if you have a robot there, it's not going to change human touch. So I don't know how that's going to work, but the goal is to have AI do basically everything.
Yeah, you know what? I can say my mom's had health issues recently and has been in and out of the hospital, and she's in her mid 80s. Um, I don't think I would be happy if it was AI taking care of my elderly mother.
Mhm. Mhm.
You know, there's you need the compassion
Mhm.
and the personal touch that you get from someone, even if it's for some people who don't have family with them, a hand on the arm
Mhm.
just to let them know that there's someone there with them. And you're not going to get that.
Yes. No,
Huh.
you're not.
Interesting. We could probably do a whole nother show on that now that I've gotten into it. So, anyways, one of the things I wanted to talk to you about because I know, see, I'm in Canada. Obviously, you're in the US. When the pandemic hit in 2020, things were very different in the two countries, the way that it was handled. Um, I mean, we both had cases, obviously. Our population's 1/10 of yours.
Okay.
So that makes a big difference as well. We
Mm.
only have a couple cities that are really large, where people are kind of on top of each other.
Okay.
Um, and seeing what was happening in the US during COVID, like we had complete lockdown. Like you were not allowed to leave your house except to, go get groceries. You weren't
Mhm.
even allowed to be in a car. If you had someone else in the car with you and got pulled over, you had to show ID that you both lived at the same address.
Wow.
Like they were strict,
Mm.
um, which thankfully I think lessened. a lot of what was happening. I mean, it was still bad, but it wasn't to the extent that the US dealt with. Because, I mean, honestly, we were still having temporary lockdowns into 2021. It wasn't just the first few weeks and then everything was open again. You know, it took months before we could get back into a restaurant, and then it was only on the patio,
Mm-hmm.
you know, or if you had to go into, you know, if you had to take your dog to the vet, they would come out to the car and get him and take him in. You weren't allowed to
Mm-hmm.
go in with them. Um, and you were front line during the pandemic in the US. And I'm sure as soon as you said nurses don't earn enough,
Yeah.
it made me think of that because they really don't
Yeah.
for everything that they went through. Even here, they're paid very, very well,
Mm-hmm.
but you're still putting yourself at risk. You're putting your family at risk. Um,
Mm-hmm.
what was your experience like during that?
So the when I research like from an epidemiological standpoint, they said that the first case was noted in December 2029 in China. And because I'm the type of person where I want to know the origin of something. Um, and so during that time, like you said, 2020 was just fast paced. You didn't know like what to do because we didn't have research about COVID-19. So my experience was a little stressful because I remember when it first emerged, um, I was pretty much, although I had my own house, I'm my only child. So my parents were like, come here, come here. We had shut down for 6 weeks. But how the US is created basically and how we run is that 6 weeks is too long because everyone is losing money. Um, so unfortunately, we opened up and a lot of people that we did not expect died. So my dad's best friend that I've known since birth had survived Vietnam War, had survived incidental gunshot. He caught COVID-19, and he uh, everyone wants to. I had to make a status about this. I have about 5,000 followers, over 5,000 followers on Facebook. So I had to make a status about this, but not him, but he went in the shower to take a shower and then planned to go to the emergency room while he was short of breath. And then I saw it done again in someone that they didn't even know each other. Everyone kept trying to take a shower before they went to the hospital because I don't want to smell bad. And so he got out of the shower and he couldn't catch his breath. Of course, it deoxygenated him, and they tried everything, and he died. Died right outside of his apartment, and I had never heard my dad yell how he yelled. He just couldn't believe it. And then I had a close nursing friend. She actually was a nursing leader, and she went in the shower again, and she didn't make it shortly after being out the shower. So I had to make a status, and I was like, look, we have smelled everything like under the sun. Don't feel that you have to be clean. If you're short of breath, stop what you're doing and come to the hospital. Don't take a shower. Don't get in the shower. And that status had several shares because I think people had not don't realize what we're trained to do. Um, for nurses, a lot of us, I'm a nurse practitioner, uh, but I had several years on the by the bedside, and so I have dressed wounds before, which have odors and smells. I've changed ostomy bags. I've done all of this stuff. So people getting in the shower while they have COVID-19, I'm like, we can handle that smell. You just come here. Don't do that. So hopefully I saved some lives with that. I don't know if I did. But when that happened, I was working in the psych department at a major hospital. It's the only hospital in Orangeburg, South Carolina. So it's large. But my job was to do emergency room consults, floor consults. So if someone was admitted, let's say on the cardiac floor, but they were depressed, my job was to go up there and probably start an antidepressant or something like that, even though they weren't on the psych unit. And then we had a geriatric psych unit at the time. I heard it changed to adult, but at that time it was geriatric psych. So the patients would come in, and we didn't know who had COVID-19. Even although I was in psych, they could be having a psychotic break or a schizophrenic break or bipolar, and it could solely be that. But they also could have had COVID-19 because we don't know. So I was just masked up a lot, gloved up. Um, every day I came home, I would take all of my clothes off at the door, put them straight in the washing machine, and just pray that my parents didn't get it because they didn't want me to be by myself. So that was kind of my experience. And then being a doctoral prepared psychiatric nurse practitioner, family nurse practitioner, I prescribe medication. So during that time, we had like a doctor's lounge and we were talking about COVID-19, and we're like, man, uh, I don't even know what to throw at it. So hydroxychloroquine was a medication that was used for rheumatoid arthritis, but they were saying it could have some effects to help COVID-19, but it didn't. So we were putting people on that left and right. Just because I was in psych, I was helping in any discipline because I'm trained in family as well, family medicine as well. So I was giving Rocephin, amoxicillin, anything to try. I was throwing the kitchen sink at patients hoping that they would live. But what they needed, we didn't have yet, which is medicines like Paxlovid.
Mhm.
So it was emotional. And one of the cases that stuck out to me was I cared for a nurse. I didn't know her personally, and she was unvaccinated. And I mean, at that time, vaccinations, it was still so much controversy around it and whether people were going to do it and not do it. But she had COVID-19 and she was a full code. So we kept bothering her. She was going to die. It was evident that she was going to die. They had her on a non-rebreather mask, which that basically is like continuous oxygen. And her goal that she wrote down was that she wanted her kids to see her one last time because we weren't allowing visitors.
Mhm.
But without her mask, she wanted them to see her how they normally see her. And respiratory was there, and it said the moment you take off the mask, you're gonna die 10 seconds later. That's how critical it was.
Wow.
So they still said we got to do everything. She's a full code, but it was obvious she was trying to anytime any lines that we were starting, she was ripping them out. It was obvious that she wanted to be left alone.
Mhm.
So I asked her directly. I said, "Do you want to die in peace?" And she said, "Yes." So the questions I usually ask to make someone a DNR, I couldn't fully ask at that time because she couldn't talk, but we communicated in a way where she told me in so many words that she wanted to die in peace. So I wrote in my documentation, please allow patient to die in peace. No more consults, no more interventions. And that day I went home and I cried
Mm.
because it just felt so real. And having to write that, like I'm one of these people, I want everybody to live. So having to write that really hurt. But I realized that if we kept picking at her, and sticking her, that wasn't what she wanted. And
Mhm.
so we set her up in the bed to say goodbye to her children, took off the mask, and she died right there on the camera, with the kids. So she
Wow.
didn't quite get her goal. I mean, they did see her without the mask, but she died.
Oh, that's awful.
Yeah.
Um, if I'm not mistaken, I believe here, at least where I am, and of
Mm.
course, the healthcare here is province-wide.
Okay.
Um, the nurses had to be vaccinated. If they weren't allowed to work,
Mm.
which caused a lot of uproar
Mhm.
because, that's then you're taking away their right to refuse
Mhm.
and bodily autonomy. But
Mhm.
at the same time, you have to weigh it with the consequences of not. And
Mhm.
right. Um, yeah, that was a big thing. And of course, because some did refuse, it meant that many less nurses working,
Mhm.
right? So,
Yeah.
and it it's when you were talking about reopening after 6 weeks
Mhm.
because people were losing money. That reminds me, like your maternity leave is how long?
12 weeks.
12 weeks.
And and I'm in a right to work state, so they don't necessarily have to abide by that. For example, when I had my baby, I got matter of fact the CEO told me that it was a bad time to take off time, and yeah, I didn't even take off time until 3 months after she was born, and then that caused the uproar because um, although we have human resources, so I went to human resources and I told them, what was going on. And I got approved. I went through the company, got approved for FMLA, but they said I should have notified someone that wasn't even my manager, but she was a leader of the department. I should have told her and not just HR. Um, and so it's a whole big uproar about that. Because I'm really like, I really care about my work, you know.
Mhm.
But in my mind, um, that's what HR is for.
Yeah.
They're for because like I'm if I have to talk about like the struggles that I've had fertility wise, then I feel like that's kind of like no one's business at that time. Like I don't mind talking about it now, but in a work setting it's different because you have just different factors. So I had notified HR. I went through all of the protocols through HR, but because I didn't have that sidebar conversation, it basically caused me to quit once I got back.
Oh, wow. Wow.
Hmm.
See, here, um, I believe it's changed since I had my kids. I believe now it's 12 months.
Wow.
And
Wow.
you get like unemployment while you're on it.
Oh my
But if you
gosh.
want to lessen the unemployment, I think you can take 18. So you get the same amount. It's just whether you put it over 12 months or 18 months.
Oh my gosh.
And that can be
That was
split between mom and dad. So
wow.
if mom
Yeah,
wants to take 9 and dad wants to take 9,
my
so baby's not in daycare, that sort of stuff.
yes. That's how it oh my gosh. I would have loved that because so being a doctoral prepared clinician, I have a bigger responsibility. Most of the time I run either a hospital or I run a doctor's office or I am it. Like I'm the
Mhm.
sole provider. So I do understand when I go out, it's a big void but at the end of the day, like I'm like, I did everything. Like she's our only child. And, my husband, he works for a corporate,
Mhm.
he works for a bank. So they have a little bit more protection. And
Mhm.
so when it came time for his paternity leave, thank goodness he got paternity leave to help. But I looked at him and I said, Lawrence, his name's Lawrence. I was like, I need to come out of work for at least a month. Can't, I can't do this.
Mhm.
Because even when I quit the job, I went straight trying to replace it with, I've always worked like 3, 4 jobs. So I went straight into trying to do another job and you can't do that with a baby. I had my parents' support, but I was just stressed out. So fortunately, we had this exit plan, and February of this year, he let me like just stay home for a whole month. I still treated patients remote, but it wasn't nearly as stressful as getting out there with the baby and doing everything. So
Mhm.
we are a right to work state. So basically, we can be terminated for any reason without any cause. Um, and that's how South Carolina is. Now there are states that are not right to work state, and they have employment laws.
Mhm.
They say that we could sue for discrimination and stuff like that, but it's very hard to win in the state because it is right to work.
Mhm. Wow. I mean, 12 weeks. You're barely even healed at 12 weeks.
Mhm. Mhm.
That's
Mhm.
insane.
Yes.
And I mean,
Yeah.
what if you're nursing?
Yes,
You
I
know?
know.
Ugh,
Mhm.
I don't get it. Anyways, don't get me
I'm
started.
glad you told me that though, because uh, I I always like I love seeing what's going on in other countries, as well as like recently a politician proposed that women get 2 days off a week. I mean, 2 days off for their menstrual cycle every month. And I was like, I'm with that. I'm with that.
Absolutely.
I mean, oh my goodness. And they did studies recently saying that some menstrual cramps can be just as painful as a heart attack.
Yeah.
And I said, that must be the kind I have.
But you know what the problem is? It's a woman that's experiencing it.
Mhm.
If it was a
Mhm.
man experiencing it, that
Mhm.
wouldn't be a question and it would have been done 10 years ago,
Yes.
you know? Like, oh,
Yes.
anyways. Um, so as part of your nurse practitioner business duties, you do a lot of telehealth and you service a lot of rural communities that might not otherwise be able to access health care. So, what does that look like? How did you set that up?
So when I began my studies 11 years ago and I graduated, I started out in first my preceptor was located in Bamberg, South Carolina, which is a rural area as well. So my doctoral work, she allowed me to do my doctoral work in her practice, where I followed around like 58 heart failure patients, um, making sure they had ACE-ARB medication, which is something like losartan or lisinopril, making sure that they had that their vaccinations was up to date, and making sure that they had a left ventricular assessment either by route of echocardiogram or heart cath. And because the EF ejection fraction is very important to monitor in heart failure. So my goal was to reduce hospitalizations, which it because right now how it's set up is that if a patient is in a hospital for heart failure and they're readmitted within 90 days, um, then CMS, which is who governs the hospitals, can invoke penalty on that hospital for having that readmission. So my goal was to try to take the burden off of the hospital system by following these patients and trying to keep them out of the hospital. So that was what my doctoral work was about. But that was a rural community. So I really wanted to stay in rural health because it was like they were so appreciative of everything I did. And I'm like, that really fits my personality. So I wasn't allowed to stay at Bamberg, not because they didn't like me, but I had to move back with my parents because when I got out of school with my doctorate, oh my goodness, I didn't have as much money. Uh, so I started working at a rural practice, St. Matthew's Family Practice, and I was the sole provider there for a while. So the population was about 2,500 people. I would have about 25 patients on my list every day.
Oh, wow.
Uh, mhm. So, I could go in room A, it's diabetes, room 2 is just a checkup, room 3 is a pap smear, room 4 is a prostate exam. And I can have all those rooms filled at the same time. And so patients sometimes don't realize, okay, if you take time to talk to me here, then it may throw me off there for the next patient. So I always tell people, just remember to be patient. Like I'm not gonna cut anybody off, but just remember that you have someone in front of you, and I have to give them quality care. So it may not be that I get in the room exactly at 2:30. I try to do
Mhm.
it, but you can't cut that other person short, and especially like with pap smears, you don't want to rush a woman during
Oh,
invasive
no.
procedure. Yes. So I try to, take my time and also make them feel comfortable. So a lot of times, I can't tell the next patient after her, hey, I got a pap smear in front of you because of HIPAA. Like we
Mm.
have to be confidential. So when I started working in rural care, when I was diagnosed with a lot of cancers, uh, I diagnosed. I found a aneurysm in one person. I was just finding a lot of stuff. I found that I needed to make phone calls a lot. To I could have ran it through a secretary, but I like to. It's very scary for people when they first get a diagnosis.
Hmm.
And so I like to kind of try to feel like I'm holding their hand. So even if I had to sacrifice my lunch, I was calling them on the phone, which was some form of telehealth. So I always knew that this would branch out some way. We didn't have video back then. I mean, we had video, but not necessarily for telehealth. It wasn't all of the laws until COVID-19 came around, and then telehealth was like boom.
Hmm.
So um, now I still see patients. I may not detect like as invasive as I was when I was in person, but UTIs, urinary tract infections, acute sinus infections, uh, especially anything psych. So
Hmm.
now I'm trained in both. So I can give therapy over here and medication like a Abilify or Zoloft or something like that. If I feel a patient, uh, if I feel like I've done everything and they're on, let's say, 4 different psychiatric medicines, but it has somehow changed into some physical complaints, I may send them for a lab workup of their vitamin B12, their vitamin D, because if you don't have enough vitamin D, you ache all over.
Hmm.
That is a part. Pain is a part of psych as well. And so, like I tell people, that's why my business is called Whole Path 360, because it's the whole body. You don't have the luxury of just saying I'm just doing psych or I'm just doing family. So I try to do as much via telehealth as I can with my patients, and I really enjoy it.
Hmm.
Um, I I may actually get a building as well though. Just to have, but I had to first kind of get my feet wet as far as starting a business, which was scary for me.
Oh, I bet. I bet. So the rural patients that you're servicing through telehealth are now getting care that they might not have gotten, say, 10 years ago.
Mhm. Mhm.
And
Because go ahead. No, no.
do you find that their outcomes are better than they were because they're getting an earlier intervention when something's wrong, as opposed to waiting until they actually have to be taken to the ER?
Yes. I find that they're more comfortable at home.
Hmm.
That's one thing. They're more comfortable at home. And then I also find that I can follow up with them like quicker, because all it takes is, yeah, we'll have a video session, but then it doesn't stop there. And then how one of my jobs is, they can just message me once a thread is started. So I start a thread with everybody. And I'm like, send a message here. And I haven't had anybody in hospital yet since I have implemented it. Because like if they have something going on, they tell me. Now if it's something, sinus infection, urinary tract infection, yeast infection, stuff like that, I'll treat that as well.
Hmm.
And because I've been doing it 11 years, most of the time when I start someone on something, it works.
Mm.
It used to be when you first started practicing, you would start an antibiotic and it didn't work, and you had to switch it. So I kind of have learned from different patients about which ones I feel work better. Um,
Hmm.
for example, Z-Pack is very common for sinus infections, but it just started being where people just didn't find it effective. So I kind of stopped using it. Um,
Mm.
but in school, we learned, okay, that azithromycin is the first line treatment for an adult with acute sinusitis. Of course, kids do not have sinuses fully developed yet, so a lot of times we call it other things. But um, yeah, I find that the admission rate is very, very low. If they have to go to the hospital, it probably is they were non-compliant and didn't take something that I prescribed. So. And I don't get mad. I'm like, look, that's what you chose to do. Uh,
Hmm.
I mean, you're captain of your own ship. I'm just giving you guidance. And I always tell patients, like, I give them their options of medications I can prescribe, and then I tell them that I'm not a dictator, and so you have to tell me what you want to do, because you're taking the pill. Ultimately, I can say I want you to be on this, this, and this, and if you don't want to be on it, you won't take it every day. So that's why I have to have their buy-in and make sure that the care is patient centered.
Mm. Do you work on children as well or only adults?
I work
Okay.
children,
Oh,
all
nice.
across the lifespan. The
Yeah.
youngest child, well, I've done like well child visits, Of course, they have like little physicals that I do, the sports physicals, and um, I mean, I've done everything.
Yeah.
Uh, yeah, so like family, once you get your family certification, like that's what you can do with that. So I got that 11 years ago, but um, in psych, I treat children as well, but they tend to at least be like 6 years old,
Hmm.
typically not younger than that, because I mean, some things are just, behavioral.
Hmm.
And so they may not need medicine. They may need someone to talk to them in a different way. That's why like play therapy is a component of therapy, because play therapy can help kids working through, like, for instance, if their parents are arguing all the time or they're going through a divorce, their parents are going through a divorce, like kids start acting out because they can't express themselves.
Hmm.
So play therapy allows them to kind of play through these emotions that they have with their therapist. So when I got certified to give therapy, I was excited. So I still am always learning like different modalities that I can try on my patients
Hmm.
to help them.
Nice, nice. Speaking of different modalities, you are now doing holistic work as well.
Hmm.
So how did you end up getting into that after being so medical model based for
Hmm.
the start of your career?
I really listen to my patients. So a lot of times I'm like, okay, you need this pill, that pill. I don't want to take another pill. And so I did it for the patients that tell me they don't want to take another pill. You know, that sticks out to me. I rather them do something than nothing.
Hmm.
So I think the hypnotherapy uh, training was phenomenal. Um, because I think that people think that it's like this magic trick and they see it on TV. It is not that. It
No.
is going to past life regressions. And I remember you telling me you also are a hypnotherapist. So
Yeah.
that's really cool. Like I'm just starting out, but uh, having patients face their fears and then tell someone what they are seeing at the time of them facing their fears is
Hmm.
so therapeutic.
Yeah.
It's very therapeutic. And then I got more certifications and training with relationship therapy because, like I tell people, if your relationship is bad, right, and you're my patient, I have to focus on you as a person. So we may have to bring in your partner, because if you're sad or you're crying over your partner and I don't get his take or her take, or then I'm not treated the whole person. So a part of initial school was we learned that the patient includes the family as well. So I tell patients all the time, if you need to bring your partner in or your wife, your husband into the conversation and we all need to talk, then we can do that, because it's all about my patient being healthy
Hmm.
and their health is tied to another human being. Now, of course, I have them sign something that can take place, because I try to always get stuff in writing
Hmm.
regarding. Like, we can get a verbal consent and it work. It's just as good, and I can document, but I try to get it in writing as much as I can.
Absolutely. Cover yourself.
Hmm.
Yeah.
I plan on taking some herbal uh, diploma classes. I haven't gotten there yet. So it's mostly just complementary therapies, looking at like massages and um, releases. Hypnotherapy was the biggest one. Trauma informed care,
Hmm.
really like patients that have suffered vicious attacks, helping them work through that trauma. Life coaching, a lot of times, what I did not know when I started getting the certifications in life coaching is that people looked at life coaching as a cheaper way of not being a therapist. And I didn't know
Yeah.
that. But I said, well, I am a therapist by trade. I can do therapy, licensed to do therapy, but I also want to learn about life coaching because they seem so energetic. So I wanted to try to bring that energy into my visits, if that
Hmm.
makes sense. Like yeah, I can talk. I have therapy tells us what to do as far as, oh, give the patient homework assignments and do that. But we're not like cheerleaders. Coaching is like, you're going to get in there, you got to do this. And I'm like, I love that. So that's why I got some of the life coaching certification so I could glean from their experiences and just make it a well-rounded experience, and integrate everything for my patients. I don't want to be one of the providers that I say, I don't offer this, or I don't know about that, or I don't, I've heard it, but don't try it.
Mm-hmm.
I feel like doing something is better than nothing, as long as it's not, dangerous, of course.
Mm-hmm. Mm-hmm. So when you're looking, and I'm curious, I'm asking this question because I actually have someone on a podcast well, it'll be a few weeks after you go out.
Mm-hmm.
And she was diagnosed with stage 1 breast cancer and refused treatment and did everything naturally. So I guess as a nurse practitioner who was trained under the medical model, even though you're going to be taking herbal and things like that, have you ever thought where you would draw the line as to what you would recommend and not recommend?
Yeah, so we're taught to not recommend anything that's not FDA approved. Uh, so like any drug uh, has to be followed, tested for me to say, okay, I put my stamp of approval behind it. With complementary and alternative therapies, I I don't necessarily put my stamp behind it. I tell people that if you want to try it, because most of the time people come to me and they say, hey, I got this bottle of this. Can I take this? And so I'll turn on the back and read it, especially like menopausal women. They'll say black cohosh, all of that. I'll turn around, I'll read the back of it. And we actually learned a little bit about functional medicine and complementary therapies in like the medical part of the nurse practitioner school. We
Mm-hmm.
actually did learn a few things about that, especially with menopause.
Mm-hmm.
Um, but if someone has cancer, I always tell people that that's a sensitive, like just the thought, even if people say, oh, it's just stage 1, it's small, it's still a cancer.
Yeah.
And you don't know how that person is mentally like facing, like, okay, why did my body do this to me? Is my body failing me? Questions like that. So from an emotional standpoint, I would just try to be with that person from an emotional standpoint and help them work through acceptance. We call it ACT, acceptance and committance. You're committing to, you're accepting that you have this diagnosis, and now the commitment is that you're going to do something about it. So if she chose a herbal remedy, I would support her because I know that's her decision.
Mm-hmm.
Would it be my decision personally? Probably not, because um, I like to, if it's a cancer, I like to face it head on, and I want my patients to have quick interventions
Mm-hmm.
for it. But she may say, I have just as quick an intervention, but taking this herb over here. And who
Mm-hmm.
am I to say that she's not right? I
Yeah.
also read stories about people that have had cancers and they do this, they do that, or they starve the sugar, like they don't do anything with sugar, and they say, okay, that reduces cancer.
Mm-hmm.
Or people drink soursop. I've heard it all, and some people are still here to tell their story. So like I tell people, it must be some truth or facts behind some of these alternative medicines. Um, because ultimately she has to wake up in the morning and she has to decide, whether she feels like her treatment is aggressive. And if she feels like she's aggressively treated it with a herbal remedy, then I'm not going to stand in her way.
Mm-hmm. Mm-hmm. Yeah. Because I'm not necessarily medical model based,
Hmm.
but I think it's just the word cancer is so scary in and of itself,
Hmm. Hmm. Hmm.
regardless of
Hmm.
where it is.
Hmm.
Obviously, certain places like pancreas or whatever, you really don't want to hear.
Hmm.
Um, but I've seen so many different. I used to work with a woman who also was diagnosed with breast cancer, and had a lumpectomy.
Mm-hmm.
But then did it through diet. She didn't want to take chemo or radiation.
Mm-hmm.
Cut out all the sugars, vegetarian, right? All of that. And she was
Mm-hmm.
good with it.
Mm-hmm.
But then there's, my husband had lymphoma 3.5 years ago. And he wanted to go the medical route and did,
Mm-hmm.
his 4 rounds of chemo. But
Mm-hmm.
now it's no sugar, very little fat,
Mm-hmm.
on an ongoing thing, no recurrence or anything, thank God. Um, so it's tough because you hear success stories,
Yes.
but then I think if it was me, I think the fear might override everything. And I don't know if that's
Mm-hmm.
necessarily healthy, you know?
Mm-hmm. Yeah, I know what you I know. I just feel so, we have a duty to warn. And so if something is not FDA approved, we're not supposed to really put our stamp behind it
Mhm.
because we don't know what's in that herbal tea or anything like that. So my position on the alternative and complementary therapies that I have learned about is not necessarily to recommend it to patients like verbally. Not like, hey, I'm prescribing this herb right here. I'm not going to do that probably. Just because, I have that duty to follow FDA approved stuff.
Mhm.
However, I'm not going to also be in the dark and pretend like these remedies don't exist. So that's why I have studied so hard with it. I just became a fellow of the Complementary Medical Association, so I'm super excited about that because all they do is holistic remedies.
Mhm.
And so I do believe that functional medicine, holistic remedies, that's going to be where it's at because I just meet a lot of people that say, I want to do it natural. I want to do it
Yeah.
natural. Okay, what does natural look like for you? So if when we're having a conversation about what natural looks like for them, that's when these treatments can come out that are available. If someone says I want to do this or that, then they want to do it, so I can support them in that.
Mhm.
If someone says I want to do hypnotherapy, and then I heard that you're training that, then I can support them in that.
Right.
But I probably would not come to them and say this is what we're going to do naturally.
Right. Right. Gotcha.
Mm-hmm.
Hmm.
It's a fine line. I
Yeah.
know like older physicians and providers, they some of them they don't care. They're like, I'm gonna say what I want to say. But when you're a little bit younger, you're always afraid of your license and stuff. So you kind of like walk a line. But at the same time, I just kind of that's why I named my practice whole path 360 because I wanted to be a one stop shop
Mhm.
where if people wanted to go a different way, I wanted to have where I have the traditional way that they can go, the conventional medicine, and then I have the complementary alternative medicine. And so it's like one path, two paths, and the third path is that we could do both.
Right.
So, mhm,
Well, it's called complementary, right?
mhm, mhm,
It's
mhm,
complementary for a reason.
mhm, mhm.
So what's the
Yes.
next big exciting thing for you?
So I will be at the 100 Women to Know in North America ceremony and event uh, in April 12th, 2026 to April 14th, 2026. And I'm speaking in two segments, um, Sunday shop talk, and then talking about, uh, I'm leading a micro panel where I'm talking about it's okay to reset and stop and give yourself a break in life. Work life balance is truly hard and it's something that we navigate. I just saw a physician online that quit medicine after, I think maybe after 6 months. Like he went through all of the residency and stuff, and he quit. And people were just like saying, "Oh no, he should have got that check. He should have." But your mental health is top in healthcare. It is very tiresome
Mhm.
as far as like it's nonstop. You can work every day. Every day someone needs your help. And so I wanted people to not be so hard on him because yeah, he's taking a break from it to do like content and internet stuff. But I respect that because I think we've all felt like that before, especially like when we
Hmm.
talk about COVID-19. COVID-19 as a line worker, people were afraid for you, and you were not sure whether you wanted to come back to work the next day or not.
Yeah.
So I that's the next big thing for me is doing the speaking 100 Women to Know. It's sponsored by Visa, JP Morgan, and Aaron Wealth Advisors. So I'm super, super excited about that. Um,
Nice.
I have a few other things. I have a board meeting. I'm a board on the alumni board for the Medical University of South Carolina, and we have a meeting shortly after that. So that's another thing. And then I'm possibly speaking again about AI later that month as
Wow. Busy girl.
well.
And running your practice through all of that.
Yes, yes. And I'm gonna have some commercials coming out for my practice. I was
Oh, neat.
really, yes, I was so excited. So right now, work for other people, and this is finally an opportunity for me. I don't plan to do it full time yet, but at least I'll have it on the side where I can get other patients because I'm licensed in other states as well. I'm licensed in New York, licensed in Florida. I live in South Carolina, of course, licensed in North Carolina, Arizona, Connecticut. So I want to use some of those states, not just
Hmm.
to have the licenses and just not do nothing with it. So I want to pull from some of them states and help people there.
Right. Wow. That's awesome. Good for you.
Thank you. Thank
And you
you.
have a baby.
And I have a baby. Yes. Yes. But people ask me at first, like I thought that the key was going to be I needed to sit in the house and not do anything and just keep the baby. But that made me really sad. I tried it. It made me really sad because I'm just not used to it. So I now let her be a part. Like when I got sworn into office, she was there in a pretty
Aw.
big dress with my husband. Yes, and so she pat my face, and
Aw.
it was just nice to have her there just to see it,
Yeah.
you know, because I never thought I'd be sworn in for anything. So that was very huge for
Yeah.
me and for my family.
Yeah. And now you'll have pictures when she's grown up and you can
Mhm.
show her.
Mhm.
Oh,
Mhm.
that's cute. Nice. So for people who want to reach out to you, where can they reach you?
So I have a website now. It's www.wholepath360.com. I am on LinkedIn as Dr. Cameo Green Coleman. I'm on Instagram uh, at Dr. Cameo Coleman. And then I'm on Facebook as well. It's just Cameo Coleman. I'm on Twitter, X. They can change it to X. And it's not Cameo Green Coleman, but I don't use that one as often. So
Mhm.
uh, just either LinkedIn, Facebook, or Instagram, or I have a contact form in my website, www.wholepath360.com.
Perfect. I will be putting all of those links into the show notes so people can
Okay.
just click directly. Thank you so much for joining
Thank
me.
you. Thank you. Thank you so much. I
I
really,
was so looking forward to this.
really me too. I'm like, oh, I'm coming from Canada.
Yeah, not all my listeners are Canadian though, so that's a good thing.
Yeah, I know you told me that. You say you have a lot from the US as well, so I'm just excited.
Yeah, that's awesome. So for everyone that joined, if you're watching this on YouTube and you enjoyed it, please hit the like button, click the notification bell, leave a comment. It all helps the algorithm. And if you are listening to this on Spotify or Apple or any of the streaming platforms, if you could hit the like there as well. All of it, helps us to grow. And thank you again for joining
Thank
me.
you. Thank you.
And we will see everyone later. Bye.
Yes.